Good morning. I am Dr. Santosh Kumar. I am orthopedic surgeon based in Kolkata. I am associated with Belle Clinic and Woodlands Hospital, and along with this, I head our Poorva International Orthopedic Foundation, which is aimed to bring about world-class orthopedic surgeries treatment right here in Kolkata at the most affordable prices. For our awareness, we have been discussing on several issues, several orthopedic issues ranging from joint replacements, arthroscopies to fractures in our series. And just before this, we had discussed about neck femur fracture, and now in this series we will be discussing about shaft femur fracture. Now in neck femur fracture, we had seen that that is the commonest fracture, and that is a low velocity fracture that typically occurs in elderly people, and it is in fragile bones. So just unlike that, just opposite to that, the shaft femur fracture occurs in young and active individuals, and mostly it's a high velocity fracture. That means it's a road accident fractures, and the implications are much different. It's an emergency, and the treatment is on priority. So to understand that, first we should know that femur bone or thigh bone is the longest and the strongest bone in our body. It is the longest, thickest and the strongest bone in our body, and whenever femur fractures, it's mostly because of road accident. It's a high velocity fracture, and it occurs in young active individuals. Since it occurs in young active individuals who are many times socially active, professionally active and bread earners of the society, of the family, we give priority to them for treatment, and we will be discussing the various treatment issues. Now, what are the signs and symptoms? So once a femur fracture occurs, it will appear as if there is an abnormal mobility in the thigh. There is swelling, there is intense swelling, pain and abnormal mobility in thigh. A person with a femur fracture will not be able to stand and walk. So once we see a fracture, big fracture of shaft femur, our treatment, our first step should be take the victim to a nearest healthcare center, or anybody who is trained in treatment in trauma life support system. So first we have to do the Primera Treatment, which is the first aid. First we have to look for the hemodynamic stability of the person, means blood pressure, pulse and all, whether it is stable or not. We have to splint the fracture. We have to put something externally, tie it with some splints, so that the movement at fracture site decreases, the person gets relief from pain, and we have to secure hemodynamic, that means blood pressure and pulse stability of the person. Then only we go ahead and treat the femur fracture as such. So once the person is stable, the fracture is splinted, the next thing that we do is to do an X-ray, wherein we see the location and the type of fracture. Now this shaft femur fracture can be towards the upper side, which is known as proximal femur. It can be towards the middle side, which is known as shaft femur, or it can be towards the lower side, which is known as distal femur. Once we do the X-ray, we can see this. Like in this X-ray, this is a middle shaft fracture. We can clearly see the upper segment and the lower segment. It's broken over here, and this has moved out. So this is a type of middle shaft femur fracture. Once such a fracture occurs, the treatment of choice is to do a femoral nailing. Now what is a nail? Nail is a rod which is put inside the bone. Our bones are like pipes, hollow or like bamboos, wherein there is a space in between them, and we insert a rod from top to bottom, which is known as femoral nail. Now the advantage of femoral nail treatment is that it's minimally invasive, it's microsurgery, and the fracture becomes immediately stable, and we can make the person stand with auxiliary crutches or walker from the very next day. So once we put the nail, it looks something like this after X-ray. So the nail is put from here, the rod is put from here, and it goes down till here. So we put it with a rod, and multiple screws are put. So this is known as anti-grade femoral nail or femoral nail. This rod is generally made of titanium, preferably of titanium, or sometimes of stainless steel. So once the rod is put, within the next few months, as you can see, the fracture unites. This fracture unites by something called callus formation, means the new bone grows and the fracture unites, and it becomes as strong as it was before. So bone, once it unites, it generally becomes as strong as it was before fracture. Now sometimes there are multiple fractures, which is known as segmental fracture, or the fracture can be on the upper side, which is known as proximal shaft femur fracture. That nail is also that fracture is also treated with femoral nail. So one nail can treat multiple fractures in the femur bone, multiple positions, whether it is proximal shaft, whether it is mid shaft, or whether it is distal femur fractures. So all this can be treated with one nail, and there is a screw which goes inside the head, and there are two screws lower down which provide rotatory stability to the fracture. If the fracture is lower down, it is known as distal femur fracture. If the fracture is lower down, it is known as distal femur fracture. And in that case also we can put a rod. We can put a rod in which there are multiple screws on the lower side. These multiple screws give stability to the fracture, and this rod gives stability to the whole bone as such. So as far as possible, all these femoral shaft fractures are treated with rods, but sometimes, several times, it is not possible to treat with rods, especially if it is in the lower side. In that case, we treat with something called plates. Means there is a plate which sits on the bone, and then multiple screws are there which fix the fracture. All these are type of internal fixation. All these are type of internal fixation, whether it is rod or whether it is plate. These are all internal fixation because they are inside the body. They are inside the body and they sit on the bone. So the plate sits on the bone and multiple screws. The fracture fragments are reduced. Means the fracture fragments are brought back to their initial position, and then it is fixed. This is known as open reduction and internal fixation. So these fractures, they are reduced, put back to their initial position, brought back to the initial position, and then we put plate and multiple screws to fix them. Sometimes when the fracture is very near the knee joint, the knee joint is also fractured, and the person is elderly with osteoarthritic knee. In that case, we can go ahead with custom made knee replacements. Like in this case, we have done knee replacement, and there is a special knee replacement in which the rods are there to fix the fracture above that, and it is fixed with multiple cerclage wires, and this is another type of fixation. Now most of the femur fractures are something called closed fractures. Means the bone has broken but the skin is intact. So there is intense amount of swelling, but still the skin is intact. So we do all this internal fixation for those type of fracture. Means the fixation is inside the body, that is known as internal fixation. Sometimes the fractures are really bad. What happens, there is a road accident, a big tire or wheel has gone over the thigh. In that case, not only the bone has fractured, the skin is cut and the muscles are injured and the fracture is exposed. The bone is seen from outside in those cases. So that is known as compound fracture. In those cases, we cannot put nail and screws directly. So we may have to put something called external fixation. Means fixation frames which are outside the body. The most versatile of them is known as Elizaro fixators. These are all Elizaro fixators, wherein there are multiple rings which put outside the body, and then from those rings thin wires like cycle spokes, they go inside and they fix the fracture, and this is an external frame. This allows for the skin and the muscles to heal while the bone is also stabilized. This allows for skin muscle cover to regenerate, and while the bone is also fixed, and after that it is removed, and we go again after the skin and the muscles heal. This is removed and we go ahead again with internal fixation. So this is all about the shaft femur fractures.